What are the main risks of having a tummy tuck?
Well, the main risks of having a tummy tuck.
So we have a patient
That's
who's
a great question.
very
Tell me.
nervous, and she wants to know all the information, and she said, "But what are the risks? What are all the risks of having a tummy tuck?"
Yeah. Okay. So it is big surgery, and it's interesting because it's surgery I do really regularly. We do it a few times a month.
Oh my gosh, a few times a week, a couple of times a week.
Okay, so we do it very often. And in preparing people for it, I like to show them a video, and I've got this sped up video of me doing a tummy tuck. And it's when the skin is kind of up and my hand is in there right up to the rib cage that they start to get a bit jittery. But actually, I just, it's fine. And this is very regular, and this is done very often. And actually, I think seeing the whole thing like that, it is big surgery, but you get through it, and it helps understand why you feel the way you feel afterwards. And sometimes people feel various sensations, like I've got this sort of sharp pulling pain if I try to stand straight, and say, yeah, that's because the stitches on the underside are quilting down the skin, and they pull when you try and stand straight, and that will give you a sharp, very well localized pain, and that's okay, and that will go because those stitches will dissolve, everything will stretch out, it's fine. So what are the main risks is the question. The main risks are the common risks. So you will have scars, and you can have abnormal scars. You will not be able to stand straight for maybe a week or two. I'm always a bit cautious if people can stand straight too soon. It makes me a bit, did I not remove enough? Niggles, aches and pains. Seroma is one of the major risks in terms of frequency. It's reported as often as 1 in 4. Honestly, I see it maybe 1 in 4 years. It's really not as common as is reported, but it's relatively, that's one of the more frequent complications. But on the other hand, it's very benign. It's easily dealt with. So if you were to develop a seroma, which is a collection of fluid, and it sort of wobbles, your skin would wobble like a waterbed. You come in, it gets drained off. You often have to repeat that several times, and then it goes. So it's a fairly benign complication. Swelling is, again, very common indeed, but very benign. Most people know.
Very manageable, isn't it?
They're going to experience swelling, and it will go. This too shall pass. Numbness of the skin, very common indeed. For the most part, that settles down, but actually there's a strip between the belly button and the scar that usually doesn't settle down, and that may be permanently numb. Interestingly, if you were to get a seroma, I'd put my needle in through that numb bit so it doesn't hurt. So hey, silver linings. So yeah, there are potentially serious complications, and thankfully, the more serious the complication gets, the rarer it is as well. Because obviously, we just wouldn't do the operation if there were frequent serious complications. That professionally, that makes us think, well, hold on, sunshine, we shouldn't be doing this. And those serious complications are things like a blood clot in the leg, a deep venous thrombosis, which even that is manageable. If you were to get a DVT, what we really don't want to happen is for that to progress to a pulmonary embolism. So if you were to get a DVT, we would be alert to it, we'd diagnose it, we'd get you on strong blood thinning drugs to treat it. And if we do that quickly, for the most, usually, and I say usually as if it's a common thing, I can think of 1 DVT in recent years.
Yeah, 1.
Yeah.
I can think of 1 ever.
Yeah. And that was managed, and there was no kind of adverse consequence of that, except it was uncomfortable at the time.
And she also had
and she had a clotting disorder, which we knew about. She had a tendency to form blood clots. So actually she was on pretty advanced A-level anti-clot precautions anyway, and got a clot nonetheless. So yeah.
It was managed and she was fine.
Yeah. So what are the risks? Those are the risks. I suppose the other risks, I tend to actually focus more on the things that might lead to dissatisfaction, because abdominoplasty surgery is a very functional operation. It has lots of functional benefits, but really it also has great aesthetic benefits as well. And I kind of want to set expectations on that. And so it's really a case of using judgment to see if we're going to get the result in you that you might have in your head. So I really try and get in your head and understand what that result is, and just to see, is that achievable or not? Blast from the past. Hey you, so lovely to see you. I hope you're doing well.
That's given me a big smile. Lovely
Yeah,
to see
it's
you.
great to see you. We are talking about tummy tucks. Yeah, it's really the biggest thing I try to warn people about is really just setting levels of expectation. So, you know, you if someone has got a history of massive weight loss, then they're not going to end up with very tight skin in the long term. It'll be much tighter than it was. They won't have the redundancy, hopefully, but it won't be tight like you may expect for a good few years after you've had a tummy tuck, if you haven't had massive weight loss. Similarly, if I like to, I used to actually have, but I don't use it so much anymore. But I had this diagram that was really helpful of lots of body silhouettes from really, you know, underweight to really overweight, with a sort of what I'd say is kind of, you know, ideal weight, if there is such a thing, in the middle. I suppose there is statistically at least. And I used to say, look, wherever you are, wherever you put yourself on that scale, and I'm not going to tell you where I put you, but wherever you put yourself, I might be able to move you 1 or 2 steps to the left only, not